Leadership is so important, particularly in nursing. Nursing, as Johns Hopkins University has put forth, has been in 19 years in a row, has been the leading trusted profession. And there's a reason for that, and that's because people resonate with the empathy that nurses provide, and people feel trusted in the care of nurses. And it's important that as nurses, we are led by other nurses who are going to instill these values in us and exemplify these values. And these values can be exemplified by true leadership, authentic leadership. A authentic leadership style is a leadership style that's focused on the ability to be honest in communication, in practice, nursing practice, but also just personal practice, living out life honestly, living out leadership honestly, showing and exemplifying that it's okay to not be perfect. And by doing that, it's allowing nurses and the community at large to realize that nurses have a human factor to them, and also to understand that it's okay to admit mistake and it's also okay to ask for help. Because when we ask for help, we're reducing the chance of an error happening with a med pass, with compatibility of medications, with nursing practice that we may not be comfortable with, and also with community members feeling free to ask questions when they don't really know. Hey, if this nurse is being honest about a doubt they have or a mistake they made, then I could ask, am I wearing my BiPAP wrong? Am I not recognizing the signs and symptoms that I thought I did? Did I not understand what the doctor told me? Did I not understand what the nurse educated me on? And when we talk about advocacy and change, one of the biggest things we've seen is burnout among nurses. And many studies have been showing that burnout among nurses is because of increased workload, increased acuity levels, and staffing shortages. And how do we fix that? Well, we have to make people healthier. And in order to make people healthier, as research has shown, and I pointed out in the essay that I wrote, research has shown that if we start looking at the patient as an advocate for themselves and we educate them to recognize signs and symptoms of possible future infections, for example, a hospital acquired infection like a peripheral infection like phlebitis, or a UTI caused by a Foley, or a central line infection. Hey, nurse, I'm noticing it's starting to become a little painful, and I remember you telling me that if something was painful as it was being injected into me, that I should let you know because it could be a sign of infection. Hey, nurse, I started realizing that there's a red line starting to form near my IV. If we could get the patient to be involved in this process of advocacy and get involved in a desire for change and get them involved in their own healthcare maintenance, the outcome would be great. And we would be able to reduce hospital acquired infections because we'd catch them early. Sometimes nurses are in a rush. And if the patient's involved and we reduce hospital acquired infections, we reduce workload. And by reducing workload, we increase efficacy. And not only do we increase efficacy, but we also increase the ability to focus more on other things because hospital acquired infections take up a lot of time. And so when we're able to really focus on why the patient was admitted instead of focusing on hospital acquired infections because there aren't any, then we can have better patient outcomes. And better patient outcomes means a healthier economy, a healthier community. And a healthier community can engage in their economy, engage with their families, and create a psychosocial environment that's super healthy. We want that. And that's what nurses strive for. We are not about dealing with issues because it's too late to deal with them. We're about dealing with issues before they happen. Preventative wellness. And we have to get patients involved. We have to get them excited. And it requires an authentic leadership approach to do that. Thank you so much.